Tony.
Yes.
Wonderful. So, good afternoon. I'm excited to be joining you all over this webinar focused on staying social, staying strong, and the health benefits of connection. I am trained as a clinician and a scientist, and I focus on improving cognitive outcomes in older adults. My clinical time is spent at the Johns Hopkins Memory and Alzheimer's Treatment Center, caring for patients and families with neurodegenerative conditions. And today I hope to review a topic that I am very passionate about and leave you all with some resources to learn more and take action. I have no financial disclosures. In regards to my motivation for my work as a doctor taking care of older adults and my research focused on improving cognitive outcomes in older adults, my motivation was really my grandmother. This is Erit Ebong. She raised me and is the reason that me and my family could pursue all of our dreams. And she is why I believe that healthy older adults are important pillars for healthy communities. She was strong and she stayed connected with all of her friends and family throughout the world even though she packed up and moved to the US in her late 60s. And so she's a real big motivation for all of my work. The objectives of our time together are focused on reviewing and understanding some of the terminology around social connection, understanding how common social isolation and loneliness are in older adults. I'd also like us to review the impact of social connections on health, both physical and cognitive. And then we'll end with discussing interventions to improve social connections, and I'll hopefully leave some time for questions. So please throw those in the chat so we can have additional discussion at the end. When it comes to physical health, a lot of people are familiar that the most commonly cited contributing factors to health are exercise, diet and nutrition, sleep, tobacco use, or alcohol use. More recently, attention has been shifting to social determinants of health, such as social connections and relationships. More, much so that in May of 2023, the US Surgeon General issued a national advisory that called attention to the epidemic of loneliness and social isolation as a big public health concern. So, as a medical community, we understand the significance of social connection. I think everyone is also able to understand it on an even more personal level, given some of the challenges most of the world faced during the COVID-19 pandemic. And we have many results from studies that show the profound impact that social connection has on our health. So we really know that social relationships can get under the skin to influence our physical health and even how long we live. So first, I really love this quote that really describes what isolation and loneliness are. It's by Keir Gaines, who is a community leader and licensed therapist. It says, isolation is like being stranded on the moon, and loneliness is like being stranded in the ocean and dying of thirst. So I hope to unpack these terms a little bit more throughout the talk. So when I say loneliness, really loneliness is described as the subjective feeling of being alone. This is regardless of how much social contact someone has. And it's really defined as the perceived kind of difference in between what someone expects or wants in terms of the quantity and quality of their relationships and what they actually have. Um, on the other hand, social isolation is more something that we define as an objective kind of measure of lack of social contact with others. It's typically measured by the size of a person's social network, proximity of social network members, and their frequency with others. So, social isolation and loneliness are related terms, but they're not the exact same thing. Like I shared, social isolation is more the objective, limited social contact, while loneliness is more the feeling of being alone, of feeling alone or isolated. Social isolation can occur in individuals or at the community level, while loneliness can really is really a mismatch between how much and how many, strong and both the quantity and the quality of the relationships and how much is desired. Um, Sometimes people describe social isolation, given it's not a feeling, as, not always unpleasant. But when we think about loneliness, it's typically considered as something that's, emotionally distressing and unpleasant. And though these terms are, related, and we can have people that are socially isolated and that can lead them to loneliness, but we can also have people that feel lonely without being socially isolated. So they're distinct but interrelated concepts. So, how common is social isolation? Here, I'm sharing some work from my mentor, Dr. Thomas Cujo, who looked at social isolation using a national study called the National Health and Aging Trend Study to understand how common social isolation is in older adults. And in this study, he found that about 25% of adults over age 65 in the United States were socially isolated. And this is a study that mostly includes community dwelling participants. So this is a pretty good estimate of how common social isolation is. And I'm also sharing some of the work that I did looking at social isolation in the same survey, but looking at it over a number of years. So I think that during the COVID-19 pandemic, everyone kind of became more aware of social isolation, but this has been going on, years before it. And what you can hopefully appreciate in the diagram on the right, which is just showing in this survey the number of people that were not isolated, the proportion, sorry, that were not isolated in blue, those that were isolated in green, and those that were severely isolated in red, is that people move, between these groups. So you might see some flow of the lines, between not isolated to isolated from severe to just isolated. And so social isolation we know is dynamic. It's something that can change. In terms of loneliness, it's estimated that about 33% or a third of older adults in the United States are lonely. And how does this compare globally? The World Health Organization suggests that worldwide, the prevalence or how common social isolation is in older adults is about 1 in 4, so about a quarter, whereas for loneliness, about 20 to 34% of older adults across the world are lonely. So these are pretty large proportions and amounts of individuals that are, socially isolated or lonely. A lot of what I study and the work I do is within older adults, and we know that older adults are at high risk for social isolation and loneliness because of changes that happen in individual social networks as they age. Some of these changes could be things like retirement or moving, changes with people that are passing away in terms of losing people within social networks. And so these can be very challenging for older adults. In terms of social connection, so I've described what social isolation and loneliness are. And when we think about social connection in general, this includes the interactions that people have, the relationships, roles, and sense of connection an individual, community, or society might experience. And these oftentimes fall under these three vital components in terms of the structure, which describes the number and the variety of relationships, as well as the frequency of people's interactions. Another component of social connection is the function. So, you might have the structure, but how well are those relationships? The degree to which the relationships serve the various needs that an individual has is really describing the function. And then in terms of the third component, that's really the quality. So the positive and negative aspects of each relationship and interaction really all factor in. So all of these three components factor into when we think about social connection. So, what are some risk factors for loneliness and social isolation? I'm sure if we were all on screen together and I asked people to raise their hands on if you fell into any one of these categories, there might be a lot of people that can identify with some of these. So, these include things like changes in income, life events, whether that's, retirement or grieving the loss of someone, health events, whether that's, someone has a big health condition that leads to, a hospitalization and that changes, all of the people that they once were connected with. Um, Being a caregiver, so we see a higher amounts of social isolation and loneliness in people that are helping to care for other people with health challenges, individuals with poor mental health. If people have any sensory function abnormalities, so these are things like hearing loss or vision loss, we often see that social isolation and loneliness can be more common in these individuals, as well as people with chronic illness, people with frailty and other geriatric syndromes. And then there can be some role of personality and preferences when we think about social isolation. Of course, all of these risk factors that I mentioned can also go both ways. You can also see how these things can also further worsen feelings of loneliness or the objective lack of others with social isolation. So they can really go both ways. Next, so now that we understand what social isolation and loneliness are, how do they impact our health? We know that people who are lonely and socially isolated are more likely to have health problems. The mortality, and when I say mortality, I really mean the risk of death, as associated with being socially disconnected is similar to those mortality rates in people that smoke up to 15 cigarettes a day. So there have been multiple studies looking at this in terms of the health impact of being socially disconnected, and they found that the increased risk of death is so high. It's similar to if someone were to smoke 15 cigarettes a day. So that's pretty significant. There have been large population studies that have documented this, and even studies that track people that are initially healthy, and track them over time. They find that individuals that are more socially connected live longer, while those who have deficits in their social connection, including either isolation, loneliness, poor quality in relationships, they are more likely to die earlier, regardless of the cause of death. There was actually a recent review in 2023, which I cite on the right there, that included 90 studies looking at this, and they found that um, both social isolation and loneliness were significantly associated with an increased risk of death across, several studies. So this is not just one study. This is many studies that are identifying the same thing. I also mentioned beyond physical health, social isolation and loneliness can really impact cognitive health. Social connections really matter for our cognitive health, and the risk of social isolation, at least, is potentially modifiable in older adults. Um, Here I'm presenting a study by one of my colleagues, Dr. Huang, who used that same database I described earlier, that same survey, the National Health and Aging Trends Study, to look at participants, pardon me, that were in the study for 9 years. And she looked at those that were initially, socially isolated. And then over the years, looked at in those participants, the proportion that developed dementia and comparing those participants that were socially isolated to those that weren't, she found that there was a 27% higher rate of dementia in those that were socially isolated. And this was controlling for other known risk factors for dementia. So this study and others really show that social connections really matter for brain health. Research has linked deficits in social connection to several bad health outcomes. So I've mentioned a few. Within the mental health and cognition category, there's studies that show that social isolation can really lead to sleep disturbance, depression and anxiety, both mood symptoms, stress, even suicidality and dementia. In terms of physical health, there are studies that show that deficits in social connection can lead to fatigue, heart disease, diabetes, obesity, disability. And then social connection deficits also really impact health outcomes. There have been studies looking at rates of hospitalization in those that are socially isolated versus those that aren't and find higher rates, as well as studies looking at the rates of nursing home entry in individuals that are socially isolated, and they find that those are higher in those individuals than people that have, you know, good or strong social connections. This diagram here is from the Surgeon General's report that I mentioned that came out in 2023 that focused on the epidemic of loneliness and isolation. It's outlining how social connection can influence health. We believe this occurs in a variety of ways. So social connections can either and it can do one and all of these things. So they're not all mutually exclusive. Social connections can impact the biology of disease by impacting inflammation, increasing stress hormones to really lead to those poor health outcomes that I mentioned. Social connection can also really impact individual psychology in terms of contributing to stress, reducing some resilience and hopefulness, and really lead to those poor health outcomes. Additionally, social connection can impact health behaviors. So there are studies that show that individuals that are socially isolated and lonely have poor health behaviors in terms of less physical activity, poorer nutrition, higher rates of smoking, poorer sleep, and all of those behaviors can go on to then impact those health outcomes that we discussed on the prior slide, and really might relate to how social connection influences health. So I've talked a lot about what poor social connections can be associated with in terms of, how that can really impact health risk. But on the opposite side, there have also been studies looking at individuals with strong social connections, and these have found increases in longevity in individuals that have stronger social connections. They also have found improvements in the immune system, meaning that people are able to recover or fight diseases faster. And they've also seen that individuals that have stronger social connections tend to have lower levels of anxiety and depression. So it can really be very beneficial for mood. And it's thought that strong social connections really generate a positive feedback loop where people are feeling socially well, emotionally well, and that contributes to some of their physical health and those health behaviors that we talked about. So now you all know about social isolation and loneliness and how impactful social connections can be on health. So what do we do if people are having deficits in social connection? There are direct interventions and indirect interventions. Some of the direct interventions include things like building up social supports and enhancing interactions. Some ways that I do this in my clinical practice is by social prescribing. So I tend to ask my patients, who are the people within your social network, or who are, who's your tribe basically, and what do you do with them? And are there ways you can increase those both the amounts of the connections you have and the quality and strength of those connections. So sometimes I'll tell people, a lot of my patients, I tell them, is there a community center that you go to, or something that you go to where you're with other people, and if they say no, I'll come up with some strategies of ways they can find those in their communities to engage with more people. You all are attending this webinar, which makes me think that you have some knowledge of some ways to connect with community-based programs, and so that's already wonderful. In terms of indirect interventions, so I mentioned that some of the risk factors for social isolation and loneliness are things like sensory impairment. So this is things like hearing loss and vision loss, as well as things as functional limitations. So at times when we address those factors that really impact social connections, we can indirectly intervene. So for a lot of my patients, I tell them to have their hearing evaluated by an audiologist. And oftentimes, if they identify hearing loss, sometimes there are ways we can intervene on that with a hearing aid, and that has been shown to really strongly impact social connections. And so that's something, a way to indirectly intervene on social connections. I tell everyone it's important that you have a primary care provider that you see regularly and that you discuss this with. So, the same way you go in to see your doctor and you tell them, oh, I've been feeling this or this in terms of your physical health, your social health is also really important. And they're another tool that you can strategize with some ways to intervene that are more specific to your life and to the changes that you have going on. For example, sometimes when I see people, if they've just retired, that can be a really challenging time where a lot of their connections were mostly with coworkers. And when they no longer have that job that they're going into to see people, they sometimes, pull away because, they haven't had to make maybe other connections outside of work because they've already had that. And so coming up with a specific plan for that person on ways they can continue to engage with people, whether it's through volunteering or engaging with their faith communities or a community center, just strategizing ways can be really helpful. We talked about some of this already, but I just want to drill it home that there are so many benefits of social connections. We know that there are better health outcomes, less burden of disease, improved cognitive function, associated with longer survival. And ultimately, these can lead to downstream improvements in things like the overall health of a community. So I mentioned that a big motivation for my work as a doctor that takes care of older adults and a researcher that focuses on cognitive outcomes in older adults was my grandmother. And really her social and cognitive and physical health really was so beneficial for our whole and entire community. And so she really had kind of a domino effect with that. And so social connection can be good for the individual, but then also that individual then pours it into, their community, obviously. So I wanted to go over a couple of additional specific interventions that I've seen benefit with some patients. And these graphics are from the National Institute on Aging website that has specific resources on loneliness and social isolation and ways to get connected. So it's recommended that you can find an activity you enjoy or learn something new. Typically, in these experiences, you might meet people with similar interests that you can connect with. I always recommend moving, so getting exercise. We know that exercise decreases stress, boosts your mood, and increases your energy. Of course, whenever starting a new exercise program, it's always okay and beneficial to discuss it with your primary care providers to make sure that there are no stipulations that they have. But exercise can be a great intervention to increase social connections. They also recommend staying in touch with family, friends, and neighbors. This can be both online or by phone or in person. I think that although the COVID-19 pandemic had a lot of detrimental effects, our ways for communicating and staying in touch with one another when we're not in the same place have really improved. The National Institute of Aging also recommends considering adopting a pet, as animals can be a source of comfort and can lower stress and blood pressure. I would talk this over with your families first because pets can be a lot of work, as you all might know, but these are just some interventions to consider. Some additional strategies for staying connected are things like adult day programs, engaging with a therapist or counselor, scheduling a specific time to stay in touch with certain family, friends, and neighbors. This can be hard, right? Because everyone has their own schedule, they're going about their days. And so if there's not maybe a known time, when you call someone on the phone or when you go out and eat dinner together or something, like that's a way to put it in your calendar so you're remaining socially connected with that person. Um, just have a couple more specific group exercises that are great are things like walking clubs, Zumba, which I enjoy doing, and many gyms have group exercise fitness courses to consider. And then just a very basic one, like how many of us actually know our neighbors? Just going and introducing yourself to your neighbors. And sometimes that can be scary, but I'm sure they would love to meet you all. I love meeting my neighbors, and I'm always so surprised when someone has been living next to me and I've not even shared my name with them. So that's a great way to increase the number of people in your network. We talked about faith-based organizations as a good way to engage with others that might be doing activities that you're also interested in. And then, of course, there are a lot of local service agencies like libraries and community centers that have various events throughout the week to engage in. I also list here for caregivers, as caregivers are a specific population that have typically higher rates of social connection deficits, is consider joining a caregiver support group. These can be really beneficial. A lot of times I have patients and families that share with, whatever their diagnosis they're going through, they feel so alone. And once they join a caregiver support group and hear from other people that are helping to manage the same condition with their loved one. It just reduces some of that burden and the stigma of feeling alone and that isolation. And also, there can be some programs that focus on providing caregivers with respite and time to, do those things that they enjoy because caregiving can take up a lot of people's time. And so, just engaging with caregiver support groups and programs that provide respite services can be really beneficial for caregivers. I list here some additional resources for ways to engage. These are all websites, and when I share the PDF of the PowerPoint with Tony, I'm sure he can send these out. I wanted to highlight a couple of these resources because I think that they are untapped. There is a cyber senior community groups. So sometimes people are like, well, I live in an area where there are no community centers. Like, how can I engage? This website, Cyber Seniors, they have a lot of different programming for older adults related to a variety of topics. And so that's one way that even if you're in a location that doesn't have, immediate physical resources, you can still connect. There's also AARP. They have virtual community centers, and they offer a variety of programming, which I've actually wanted to join. Like they offer things like attending a museum virtually, which is really cool, and you get to learn about art. I've listed some of the uh, activities that they had on their website recently, things like webinars similar to this, focused on a variety of topics that are interesting for, anyone really. There's a webinar on powering up your knowledge on hybrids and EVs if you want, wanted to learn about cars or something new, just different ways to engage. And I think that virtual community centers are also a great option. Senior Planet also has a variety of live online classes for seniors. So sometimes, because of how people are maybe limited in either their functional abilities or the ability to get to another place to move, engaging with one of these online classes is a good way to still be able to benefit from that. They have things that range from things like chair yoga to stretching to activities for improving bone health. So just a variety of things that they offer. And then as I care for many patients that are living with dementia, I always like to highlight that there are dementia day programs that are offered by a variety of organizations. Here I'm just listing one. where individuals, can go either, a couple days of the week to be with someone caring for them, which can oftentimes really be beneficial for caregivers and care partners to have time to re-engage in some of those activities that provide them with the social connection that they need as well. So I list some references and I will skip to questions. And then if we have time, I wanted us to do a brainstorming activity together to just think about ways within your own lives that you can increase your social connections. But I'll skip to questions now.
Thank you, Dr. Uma, for that very informative presentation. We will now begin the Q&A portion of the webinar, which our first question comes from Amy. And Amy says she is looking for ideas for how to support a family member who lives with social anxiety and has a tendency to isolate.
Yeah, thank you so much for that question, Amy. I would say ensuring that your loved one has good mental health support would be, the first strategy. A lot of times, if people are following with therapists and psychiatrists, they might have specific day programs that they might even suggest if they bring up, that this is a concern. Their social connections is a concern, sometimes those providers can actually give them specific programs that they can join. I would say also in terms of helping this person, maybe just coming up with a recurring time, whether it's once a month, once a week, as your schedule allows, to do something maybe active with them. We know that moving your body really can impact your, not just your physical health, but your emotional health. And so just scheduling, a normal time to engage with that person. But I would really, really strongly recommend that you ensure that they have good mental health providers that are um, helping to manage their anxiety symptoms so that they can then do those other things to improve their social connections. I hope that answers your question, Amy.
Thank you, Dr. Uma.
Mhm.
Our next question is, has cancel culture among all generations contributed to isolation? I find friends, as they age, seem to confine themselves more to their ethnicities, languages, religions, economic status, and usefulness, etc.
Yeah, that's a really great question. I think that humans in general are very social beings, and sometimes what happens as people age is some of those sources of social connections where you meet people outside of your, those outside of faith communities, outside of sort of the communities you live in, people from really different backgrounds might reduce also just because of, things like leaving the workforce or something like that that can really influence it. So I don't know if it's necessarily cancel culture, but that people might be engaging in things that are a little bit easier because they're closer. Yeah.
We have another question. Can you recommend some caregiver support groups?
So it really would depend on the specific condition that the person has. So some of them are specific specific to a disease condition. A helpful resource would be the Baltimore County. I'm not sure actually if everyone's from Baltimore County. That's probably a question that I have for you, Tony.
No, the
Probably not.
predominantly of this audience is predominantly from Montgomery County.
From Montgomery County, okay. Um, there are websites that different counties have for caregiver support programs. I would have to look up the one for Montgomery County as I'm not that familiar with it, but sometimes these caregiver support programs can be open to any caregiver. And then sometimes they'll have one specific for things like a caregiver of someone taking care of a patient living with dementia. And so I would start at the county website to look up those resources. Then there are also national caregiving organizations. One of them that I would suggest is the Family Caregiver Alliance, and they have a list of support groups both in person and virtually throughout the country. So those would be, I think, where I would start in regards to that question about specific caregiver support groups.
In regards to mental and cognitive health, are certain types of social activities better for brain health than others?
Sorry, can you repeat the question?
Sure, I'm sorry. In regards to mental and cognitive health, are certain types of social activities better for brain health than others?
Oh, that's a really good question, and I think something that we're still, doing research on. Um, I always tell my patients that things that they enjoy doing that can, be made social, meaning doing it with other people, are really beneficial for their cognitive health. Some studies have looked at activities that are more active, to both, engage the benefits of exercise on, brain health, as well as, social engagements. I would say increasing your activities where you're doing things you enjoy and remaining being active and socially engaged would be some of the things that would come top of the mind to that question. But I always tell people also, I have a lot of people that see me and they're like, well, like, what if I start doing, this activity, but I don't really like it? I say it's better to do something that you enjoy doing because then you'll stick with it than something that isn't enjoyable. So I would start there with, what activities would bring you joy that are, engaging with other people. So you're increasing some of that social engagement. And then if those activities can be active and interactive, those would be best.
One of our audience members would like to say or ask the question, what can someone in age early 60s do who is isolated due to transportation, retired, cultural background, health problems, etc.? Social activities for elderly seem to be mostly ages 70s, 80s.
Yeah, so I would still try to engage with some of those community centers that I mentioned, because I think that a lot of people have this idea that, like, community centers would only be for older adults that are much older in age, but they offer a variety of things. I would also say that engaging in like a volunteer activity that you're able to do might be another way to increase your social connections. Though you have some limitations in terms of ability to get to places. And then I listed, and it will also be in the handout that I share, some organizations that, offer um, different tools and resources for people to engage, and that's people of all ages. So that would be, another good tool to check out.
How does stress related to loneliness impact the body over time?
Yeah, that's a really big question. I think, we have a lot of research that shows that stress can be bad on the body over time. And so if you think about the diagram that I showed in terms of how social isolation or loneliness can impact the health outcomes, it's probably through a variety of mechanisms, both biologically, and also behaviorally. So we know that people that are more stressed tend to exhibit more harmful or negative health behaviors. And so it's likely through several avenues that over time it can really impact health.
What warning sign suggests that an older loved one may be socially isolated?
Yeah, that's a really good question. I think that, you know, being a little more withdrawn, not, wanting to do the things that they used to do, would probably be a good telltale sign, that there could be some isolation going on. On the one of the websites that I shared, I'm going to actually go back in my PowerPoint. One second. Um, the AARP website, they actually have a tool for people to take kind of a screening to see if they are socially isolated. They ask a couple of questions. And so that might be a good resource to share with that family member, that they could, take that screening. But I would say just, if people don't have, many social contacts, that's probably a good telltale sign. If there aren't activities that they, have that they're engaged in that really include others, that would be another telltale sign.
Our next question is, what role do intergenerational relationships play in healthy aging?
Sorry, can you ask the question one more time?
Sure. 1 second. Let me pull it back up.
No
What
problem.
role intergenerational relationships play in healthy aging?
Yeah, that's a wonderful question. I think that intergenerational relationships can be wonderful for everyone involved, right? So, um, just because people are older in age doesn't mean that they don't have things to offer people that are younger in age and vice versa. So they can be really beneficial. So, all of these, activities and connections in increasing them. I'm not just saying increase them amongst, other people that are your same age, but really with anyone. And so I have a lot of um, patients and families where there are multiple generations, living even within a home, and people share how that can be really beneficial because, there's different people that are in charge of, different aspects of the social calendar. So intergenerational relationships can be really beneficial for healthy aging.
Dr. Uma, we have just two more questions and then we can transition to your activity if you'd like.
Sounds good. And I'm just going to put, I don't know if this will go to you, the website for that assessment that I talked about on, if people wanted to do it from AARP for that family member. Maybe you can share that too.
Sure.
Okay.
If someone could take just one step this week to strengthen their social health, what would you recommend?
Oh, that's a really good question. It would really be person specific because if they're, it really depends on their context. But I would say, a good first step is just evaluating, who their connections are. And then if they there's some people that have a lot of connections, but they don't feel like they're deep connections or quality connections or someone that, if something were going on, you'd feel comfortable either sharing with or wanting them or getting their assistance in something. So I would first evaluate the quantity and the quality and then make a strategic move to improve one of those. So if the quantity is low, thinking about ways that you could engage with more people so that you at least, have additional connections. And then if the quality is low, maybe considering if there are ways you can either set up a time to um, uh, do, whether if it's an activity or even just talking on the phone, ways to strengthen the quality of the relationships you do have. I'm thinking of an example, just everyone gets so busy and so maybe not checking in. You're like, I have this friend or this cousin that doesn't necessarily live close. Well, can you set up a time to talk with them on the phone that this week, and then can you share, that you'd like, to continue to strengthen that relationship. So my answer would really depend on the individual's current social connections and, sort of not just the quantity, but the quality. And then my recommendation would be to try to improve one of those in some way.
And if you had one message that you would like community members to remember about the importance of staying socially connected, what would it be?
I would say that it's as important as, other health risk factors. I shared how important social connection is for your physical and your cognitive health. And I think that, for a long time, we've really focused on kind of the physical person and not the social or emotional person. And our research shows that both are very important. And so the same way that you are, thinking about your physical health and, going to your doctors and telling them, what you have going on physically, do that also socially because social connection and health is really important for overall physical and cognitive health.
Thank you, Dr. Uma, for answering the questions. Now I'll turn it back over to you for your interactive activity.
Okay, sounds good. Well, we kind of started some of this with the questions. You guys were ahead of me, but since we do have some time, I thought we could also just think about ways to as a group, or individually, improve our social connections. So the first question I'd ask is, what are some of the social activities you enjoy and maybe have given up? And this could be due to a variety of reasons. So sometimes I will be talking with people that are care partners or caregivers, and just the time required for that might be the reason that people have given up some activities. There's some activities that people sometimes can't do because of physical limitations or um, transportation limitations. And so first, I'd just like people to take a minute and think about what are some of the social activities that you enjoy that you may have given up. And if you guys want to throw it in the chat too, I'm happy to look at the chat as well. And while you guys are thinking, I'll give you an example of something. So, um, as I have been training and doing work for some time, I really enjoy exercise and group exercise. And I had given up doing this because there was just not enough hours in the day, it felt like. So things like Zumba, which I know I enjoy and bring me a lot of energy and connection with other people that I'm dancing with, I had given that up. I also see someone wrote in the chat, Amy wrote, inviting people over for a meal. Someone, Diane wrote, going out to dine in restaurants because of being immunocompromised um, and missing the good dinners, but also the socialization. Yes, thank you for sharing that, Diane. That it's really challenging. If there's anyone else who wants to share, you guys can continue to do so. So I mentioned, what are those activities you might have given up because maybe we can strategize ways to, you know, to re-engage or you know, increase that activity. I know that Diane, what you mentioned is really challenging and based on your health condition. So there might not always be ways. But I wonder if there are any ways with increasing socialization around eating that, wouldn't happen at a restaurant and that you could maybe consider. Some other people wrote potlucks at home with friends, senior groups afflicted with maybe associated with religious organizations. So yeah, these are all things that sound like great activities, and sometimes there are, a variety of reasons that people might give up things. And so I would just say if there are any ways you can think about increasing or re-engaging in some of those things, while still maintaining, safety and good health, considering that. So for me and my example with going to Zumba, that just meant that I needed to make time for that on my schedule, in the same way that I make time for other people in my schedule. And someone wrote, giving up ballroom dancing to caregiving for an older parent. And so a lot of these things that you guys are sharing might not be able to change because of time limitations. But I just wanted us to think about them because sometimes, there are ways we can be strategic in engaging with some of these things, even if they look a little different than they did before. Um, and then another question that I had, as we brainstorm and think about ways to improve and increase and improve our social connection is, what are some activities that you currently complete alone that you may be able to complete with others? Um, so you guys can also throw those in the chat and I'll give us a minute.
Dr. Umar, I don't, while people are still typing their answers in the chat,
Mhm.
I don't know if you see, there is one additional question about grief factor.
Oh, can you read it?
Yes. How does grief factor in when you have lost lifelong connections? New connections are not the same quality.
Ye- Yeah, no, that's an excellent question. Grief can really impact social connections significantly, and there's no way to change that or get over those lost connections. I do recommend engaging with like grief counselors or grief therapists because that's a really challenging emotional state to deal with. Um, I would say that it can also really impact social connections because, a lot of times people are withdrawing, and, mostly focusing on the people they lost and the people that are there because it's such a kind of all-encompassing emotion. And so in addition to grief therapy, continuing to engage in things where you're meeting new people and understanding that the connections will not be the same as the person that's lost, but are still beneficial for health. So when I was younger, I was in Girl Scouts and we had this song we sang and it was make new friends, but keep the old. One is silver and the other is gold. And so unfortunately with grief and losing someone, those, connections might not be the same, but they're still going to be beneficial to your health with making new ones. So I hope that answered the question. And then now I see in the chat some of the responses for activities that people currently complete alone. We're cooking together. And so I'm assuming that means like cooking alone, but maybe could cook together. And I think that's a great idea. I think if you just sit and think about your day-to-day activities, there are a lot of things we do alone just by habit and and ways that we can, invite other people alongside us to do those things. Someone said talking with people is rare nowadays. Yeah, that can be challenging with everyone's schedules, but I think connecting with like I shared earlier, community center or different things that have other people that are interested in, connecting as well, might be a good way to target that. And then just for the sake of time, I'm going to move to the last question in our brainstorming activity, which is what is one thing you can do or one person you can connect with to help improve your connectedness? So as you improve your connectedness, you also improve others' connectedness. So I just wanted to leave us with this thought as you guys, go through the rest of the day, the week, just thinking about, who can you connect with to both improve your connectedness and their connectedness.
And Dr. Uma, Dave wrote in the Q&A, one of the activities is open mic events to get musicians out and meeting one another.
Oh yeah, that sounds awesome. Yeah, music is a great tool. And that sounds awesome. And there are a lot of events, that go on. And so I think just, you can look these up either in your on your county website or in the local newspaper or different things. Someone mentioned Busboys and Poets, and I've been there. That's an awesome place, and you can listen to great spoken word. Um, so yeah, and someone mentioned a daughter who's too busy. And yes, that can be challenging as people are juggling multiple things. And so maybe thinking about, as a strategy for, that daughter, if there's something that you all could do together that they're already doing that wouldn't require additional time in their schedule. So one idea is like when people go shopping, that can be a social activity, together. Another person shared, Judith shared, I went to a grief support group and we still get together each month for lunch, even after 10 years. Great help and made new friends. Oh, that's so wonderful, Judith. Thank you for sharing that. And I think that speaks to the earlier question about how grief can really impact social connections, but this is really a positive way and new connections that you've built with other people in that group. So that's wonderful to hear. Awesome. So that's all I had.
Okay, thank you, Dr. Uma. Ladies and gentlemen, this concludes today's webinar. On behalf of the Community Health and Wellness team at Suburban Hospital, we sincerely thank you for joining us and extend our deepest gratitude to Dr. Uma for sharing her expertise today. We hope this discussion helps make you more informed choices regarding your health. As a reminder, please take a few moments to complete the survey that will appear at the end of the webinar. Your feedback is greatly appreciated and helps us improve future programs. Thank you again and have a wonderful rest of your afternoon.